Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Heart disease in women. Introduction. Worldwide, heart disease is one of the leading causes of death and disability among women. More women than men die of heart disease each year. The older a woman gets, the more likely she is to get heart disease. But women of all ages should be concerned about heart disease. All women can take steps to prevent it by developing good habits for a healthy lifestyle. This program explains heart disease in women. It discusses risk factors of the disease, its symptoms, prevention, and treatment. The heart. The heart is the most important muscle in the body. It continuously pumps blood throughout the body. Blood carries nutrients and oxygen. The heart also needs nutrients and oxygen. The heart pumps blood to itself through arteries. The arteries that supply blood to the heart are called coronary arteries. Healthy coronary arteries have smooth linings. They allow blood to flow smoothly. This is a normal artery. Damage to the lining of the coronary arteries makes them rough. Fatty substances such as cholesterol can stick to the rough lining and collect in the arteries. As a result, plaque is formed on the inner walls of the arteries. Plaque and deposits of cholesterol on artery walls usually cause them to narrow. This is called atherosclerosis. Heart disease is a broad term used to describe a range of diseases that affect your heart. The most common cause of heart disease is narrowing or blockage of the coronary arteries, the blood vessels that supply blood to the heart itself. This is called coronary artery disease. It happens slowly over time. Coronary artery disease is the major reason people have heart attacks. The older a woman gets, the more likely she is to get heart disease. But women of all ages should be concerned about heart disease. Risk factors. Some risk factors for heart disease affect both women and men. These include high cholesterol, high blood pressure, being overweight or obese, lack of exercise, an unhealthy diet. Other factors may play a bigger role in the development of heart disease in women than they do in men. These include metabolic syndrome, mental stress and depression, smoking, low levels of estrogen after menopause. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Symptoms. When you think about heart disease, you probably think about chest pain, but a woman with heart disease may not have chest pain. If she has heart diseases, a woman may feel aches, tightness, heavy pressure, burning. These feelings may happen in the chest, the back between the shoulder blades, the belly above the belly button. The pain may spread to the jaw, neck, shoulders, ear, or the inside of the arms. Other signs of heart disease in women are unexplained tiredness, trouble breathing, trouble sleeping, feeling sick to the stomach, feeling scared or nervous, new or worse headaches. Complications. Untreated heart disease may lead to a heart attack. The most common heart attack symptom in women is some type of pain, pressure, or discomfort in the chest. But it's not always severe or even the most prominent symptom, particularly in women. Women are more likely than men to have heart attack symptoms unrelated to chest pain. These include neck, shoulder, upper back, or abdominal discomfort, shortness of breath, nausea or vomiting, sweating, lightheadedness or dizziness, unusual fatigue. Heart attack symptoms in women are more subtle than the obvious chest pain often associated with heart attacks. Women tend to have blockages not only in their main arteries but also in the smaller arteries that supply blood to the heart. This condition is called small vessel heart disease or microvascular disease. Many women tend to show up in emergency rooms after much heart damage has already happened. This is because their symptoms are not those typically associated with a heart attack. If you experience symptoms or think you're having a heart attack, call for emergency medical help immediately. Don't drive yourself to the emergency room unless you have no other options. Diagnosis. Your healthcare provider will perform a physical exam. He or she will ask you about your health and family history. Tests used to diagnose heart disease may include blood tests, chest X-ray, electrocardiogram or ECG, echocardiogram. You may need to have your blood drawn and tested for substances that could indicate that you have heart disease. Your healthcare provider may check the levels of your cholesterol and triglycerides, blood cell counts, other blood tests that might show damage to your heart. A chest X-ray shows an image of your heart, lungs, and blood vessels. It can reveal if your heart is enlarged. This is a sign of some forms of heart disease. Treatment. The goal in treating heart disease is often to open narrowed arteries that cause your symptoms. Depending on how severe the blockages in your arteries are, treatment may include lifestyle changes, medications, medical procedures, or surgery. Whether your heart disease is mild or severe, your healthcare provider will recommend lifestyle changes as part of your treatment. If you are at risk for heart disease, a healthy lifestyle can help prevent the development of the condition. Talk to your healthcare provider about an exercise plan that is right for you. Your healthcare provider may recommend that you exercise 30 to 60 minutes a day on most days of the week. If you can't get all of your exercise completed in one session, break up your physical activity into several 10 to 15-minute sessions. You will still get the same heart health benefits. There are other small changes you can make to increase your physical activity throughout the day. You can take the stairs instead of the elevator. Walk or ride your bicycle to do errands. Try some sit-ups or push-ups while watching television. Reach or maintain a healthy weight. Being overweight increases your risk of heart disease. Weight loss is especially important for women with a waist measurement of more than 35 inches. Quit or don't start smoking. Avoid secondhand smoke. Limit how much alcohol you drink. Eat a healthy diet that is full of fruits and vegetables. Limit saturated fat, trans fat, salt, and added sugar. Ask your healthcare provider if you need to limit or avoid anything else. Manage other conditions such as high blood pressure, high cholesterol, and diabetes. Medications can help you control your blood pressure and cholesterol levels. To treat heart disease, your healthcare provider may recommend specific procedures or surgery to clear the blockages in your heart. A common procedure is coronary angioplasty. It is performed by placing a catheter in an artery in your arm or groin. A small balloon is threaded to your blocked artery and inflated to reopen it. A small metal coil, called a stent, is often placed in the artery during angioplasty. The stent helps keep the artery open. Sometimes a more invasive procedure called a coronary artery bypass surgery is needed. In this procedure, an artery or a vein from another part of your body is used to bypass the blocked section of the artery. The vein usually comes from your leg. In men's arteries, plaques build up as bulky and irregular substances. Surgical procedures are often used to treat heart disease in men. But these treatments may not be as effective when treating the plaque buildup in women. In most women, plaques build up as an evenly spread layer along artery walls. Certain heart medications, such as clot-busting drugs, tend to be more effective in women than in men. A daily aspirin can have a number of benefits for women. It can help prevent heart attacks and strokes and reduce heart disease risk. Talk to your healthcare provider about the risks and benefits of taking aspirin.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Worldwide, heart disease is one of the leading causes of death and disability among women. More women than men die of heart disease every year. The older a woman gets, the more likely she is to get heart disease. But women of all ages should be concerned about heart disease. All women can take steps to prevent it by developing good habits for a healthy lifestyle. Untreated heart disease may lead to a heart attack. The goal in treating heart disease is often to open narrowed arteries that cause your symptoms. Depending on how severe the blockages in your arteries are, treatment may include lifestyle changes, medications, medical procedures, or surgery. Whether your heart disease is mild or severe, your healthcare provider will recommend lifestyle changes as part of your treatment. If you are at risk for heart disease, a healthy lifestyle can help prevent the development of the condition. Thank you for using Explain.